We have 1.8 million uninsured in Illinois now, according to the Institute of Medicine. That's the most common way that we're used to thinking about the uninsured. And recent data shows that 18 Illinoisans die every week due to a lack of health insurance. And the sort of knee-jerk reaction to that is to say, well, we need to find a way to get these guys the kind of coverage that everybody else has. Aetna, Blue Cross Blue Shield, Chickering, United Health, all the stuff that we have in Illinois. But what I want to stress is that getting people private insurance is not a solution. For one thing, being insured, as Mary Flowers constantly points out, does not get you access to care. Having insurance is no longer synonymous with having access to care. It's not about having access to insurance, it's about having access to health care. 28% of insured Illinoisans went without care due to cost last year, skipping a doctor visit, a specialist appointment, treatment, or a prescription when they need it. And illness and medical bills contributed to half of all Illinois bankruptcies in 2004, about 40,000 personal bankruptcies. Most significantly, of all those people, the 40,000 families that were bankrupted, more than 3/4 had insurance at the time they got sick. And rising costs lead to lower benefits and under and uninsurance. Recent fair share campaigns, which you probably heard about, have focused quite legitimately on companies like Walmart that don't pay their fair share. And actually, until recently, Walmart had a special program where it taught its employees how to qualify for Medicaid, effectively asking for a taxpayer subsidy of their corporate irresponsibility. But writ large, in looking at medium and small businesses and even most large businesses in Illinois, rising healthcare costs are not the fault of business. But as healthcare costs continue to rise, they have to offer less benefits, which leads to under and uninsurance. So we need to fundamentally control the cost of healthcare in addition to expanding coverage to everybody. Otherwise, the program is just going to be unsustainable. Rod Blagojevich's plan was to raise another $2 billion in taxes to pay insurance companies who take a third cut, as we'll see, to provide coverage. But as long as healthcare costs continue to rise, that kind of program is just going to be unsustainable. So, current private insurance policies offer inadequate protection. And any gains in coverage are going to be quickly offset if costs continue to rise and employers shed benefits. So, why? Why do we pay so much more and get so much less, both in Illinois and in the nation? Well, the question lies in thinking about the natural market behavior of insurance companies. Insurance companies want to enroll healthy, profitable patients and keep out anyone who's sick who actually needs costs, which, if you think about it, is the exact reverse of the way the health system should work. All the sick people are pushed out and the healthy people are kept in. And if you're an insurance company, how do you keep sick people out and keep healthy people in? Well, what you do is you erect a massive bureaucracy that has no point other than to fight claims, to issue denials, and to screen out the sick, right? If anybody here has ever had to file a major claim, you know what I'm talking about. You have to fill out 30 forms, you have to fax stuff to a guy in Minnesota, you probably have to send your birth certificate and social security number around. It's a huge pain. And if you think it's a pain for you, it's a pain for doctors and it's a pain for hospitals too. If you ever go to the doctor's office and you look behind the desk, you'll see that they have about 4 or 5 billing guys if it's a single practice. And all those people do is argue all day with the insurance companies about payment and to organize to make it happen. If you look at a hospital, they have whole wings that are dedicated to billing. I don't know how many of you have been into downtown Chicago recently, but we're in an economic downturn of catastrophic proportions. Everyone understands that, right? If you go downtown and you look, besides the Trump building, there's one other building downtown that's under construction, and it's the Blue Cross Blue Shield building. Yeah, exactly. And they're putting on, I think, 10 new floors that's nothing but billing and administration and waste. That's where our health system dollars go. The unique contribution of Physicians for a National Health Program, which is the group that I work for, is that in 2003 we totaled up how much administrative waste there was in our health system. And when we looked at it, we found out that 1/3 of every dollar that's spent in the U.S. healthcare system is consumed by administrative costs. Now, if you streamline that down to Canadian levels, where they don't have insurance companies, they don't have the bureaucracy, you just get in, see your doctor, and that's it, that's potentially $350 billion a year that you could save in the U.S. I just recrunched the numbers for Illinois using the same methodology that the Harvard researchers used under their supervision. and figured out in each sector of Illinois spending how much you could save. And when I totaled it up, it turned out that Illinois wastes $17 billion per year on healthcare costs. That's more than $9,000 per uninsured Illinoisan, and more than enough to cover every Illinoisan with comprehensive full benefits for the rest of their lives. So, we've heard a lot about the governor's plan. It's a presidential election year. We've heard a lot about the other health plans that have been offered, and the media presents it often as though, you know, Hillary Clinton has one plan, John Edwards has a plan, Barack Obama has a plan. But if you look at the details and you get down to the meat of it, they're all almost identical. It's raise more money through taxes or cutting the Bush tax cut or a tax on cigarettes. Raise more money to help people buy private health insurance, to give more money to the private health insurance companies who take a 1/3 cut for administrative waste that they use for the antisocial purpose of screening out the sick. So there's only two real options for reform in Illinois or anywhere in the country. The first is to preserve, as our presidential candidates would, private insurance companies and their waste. And the second is to create a statewide or national single-payer health insurance system that gets rid of them, recaptures the waste, and uses that to cover everyone. And I know what you're thinking now, which is, well, it sounds great, Nick, but it's just not politically feasible. Well, every time the American population is polled, 2/3 of the American population wants single-payer. It's not just because of me, though. Thank you for the applause. There was a study that came out just last month in the Annals of Internal Medicine that polled physicians, and currently 59% of physicians want a single-payer health insurance plan. And perhaps most significantly, and this is the biggest turn in the last 4 or 5 years of healthcare reform, the business community is now realizing the need for it. We met recently with Glenn Barton, who's the former CEO of Caterpillar Incorporated, one of the biggest, actually the biggest private employer in Illinois. He's the former chairman of the Health and Retirement Task Force for the Business Roundtable, which represents the 150 largest employers in the country, with total assets equaling $4 trillion. And he said, this is on-the-record testimony to the Adequate Healthcare Task Force, quote, "The quickest and simplest solution is to go to a single-payer system." He said to me, "Nick, I know. We would go up to Canada and we would look at our Canadian division and we would look at their labor negotiations, and whereas every time in the U.S. we were fighting over healthcare costs and we were fighting with the unions over what benefits they would have, it never happened in Canada. It never happened. In fact, it's so important to their economic system that the CEOs of the big 3 automakers, GM, Daimler, Chrysler, and Ford, wrote a joint letter to the Canadian Prime Minister saying that Canada's single-payer system cannot be dismantled. It is fundamental to our international competitiveness." And if you look at what's happening with the U.S. automakers, as they've been eaten alive by the Germans and the Japanese, and now automakers that formerly used to produce in the U.S. are producing in Canada. In fact, Ontario now produces more cars per year than Michigan does. The U.S. is losing its international competitiveness because of that. So, you know, the history of great social achievement is rife with instances in which the forces of institutionalized power told social movements that what they wanted was too much or too fast, and what they'd have to do was to settle for something less. I think, of course, of the abolition of human slavery, the enfranchisement of women, the Civil Rights Act, the minimum wage, Social Security. We could go on and on and on. In each of these instances, activists held fast to their principles, and they soon found that what was politically infeasible just a week or a month or a year ago was now politically feasible. And as single-payer advocates, we have to hold tight to our principles, advocate change that works, and then the implications and the single-payer system and our realization of healthcare for all will follow. Thank you.